A ruptured bicep tendon. This is the injury that I had surgery to repair and that many people seem to react with on my social media. What happened? Are you okay? How long is the recovery time? We're going to answer all of those questions for your eager eyes and give a thorough breakdown with research data, a doctor's opinion, my own physical rehab, and some video updates from the time of the injury up until now. So tune in. Let's use this injury as an opportunity for us to be wiser and learn from. Yalla, baby. Welcome back. On February 21st, I was in the gym warming up and going through my usual motions, which involves hanging. And I'm going to show you this video, which I took immediately after my accident. Watch this. So you can see a little bit of swelling now at the elbow. So the tendon, see how short the long head of the bicep is? Not good. Starting to swell a little bit. Pain is very minimal, but I was jumping up here to grab the bar with my hand, and when I grabbed the bar, I heard cluck. Pretty standard exercise with quite the awful outcome. So how did it happen? Well, first of all, it's worth noting that the day before I had worked out arms and had a really good pump in my biceps and triceps. Now, the reason that's relevant is because my arms were inflamed, and that's normal in the recovery process. The process is called supercompensation. You arrive at the gym and you break down muscle fibers during physical exercise so that they can recover and return to a new elevated level of performance. Now, the following day, I went to do something I do daily, hang. And it's something that I believe all humans should do on a daily basis, along with walking and spending time in a squat. At our gym, we have high straight bars attached to the top of our racks. And in between all of our racks, we have our benches. Now, usually, I step up onto the bench and grab a hold of the bars and drop my feet and proceed to hang for max time. Although this time I was a little bit lazy and I decided to pull the bench out and jump up and grab the bar. The reason I did that is because I wanted to use the rack for some squats. So I took a bit of a shortcut. First attempt, I jumped up to grab the bar with pronated grip and it went fine, no issues. I rested, and then the second time I went to grab the bar, I jumped up using a supinated grip. And the eccentric load of my body weight was too rapid and strong for my biceps, which were inflamed, to handle. So all that body weight went onto my tendons and I heard pop. And immediately I kind of understood that I popped my bicep tendon, I just didn't know where. It wasn't painful, but I did kind of hear the pop and it was something strange that I hadn't felt before. So I knew something was wrong. I did a third set of hanging and I had no issues, but I saw the bicep shorten up into the meat of my arms, and that's when I decided to stop and proceed to call the doctor. It was really a perfect mix of training arms and taking a shortcut by moving the bench away from the rack and jumping up to grab the bar. I'm a human, I have flaws, I make mistakes, but I learned my lesson and I will heal from this. Now that we know what's happened, let's take a look at why I chose to operate surgically on my bicep tendon rather than letting it heal on its own. Okay, so the video I took immediately after injuring my bicep tendon was actually meant for my friend and Dr. Rizwan Manaz. He took good care of me, took immediate action by getting me booked in with an orthopedic surgeon and then giving me a requisition for an MRI. Basically what I had to do is see the severity of the tear. Was it just torn or had I completely ruptured it? Turns out I ruptured it pretty good. The MRI showed that the tendon was actually underneath the short head of the bicep here. I ruptured it pretty badly. So if you know me, you know that surgery is the last option I want to exhaust before going down that route. That being said, this was 100% the best option for me, and I'll show you why. I did a few research on my end. There's numerous studies, and the one I'm going to show you here, distal biceps tendon rupture, advantages and drawbacks of the anatomical reinsertion of the modified double incision approach. I'm going to link this here. You can look through it yourself, and I'm just going to scroll down to some parts that I saw. So, okay, some results here. So out of 63 patients were considered for eligible for assessment and were evaluated an average of 24 months to follow up. And they recovered compared to the healthy contralateral side. The recovery rate compared to the healthy contralateral side was 95% flexion, 97% extension of the elbow, 88.5% supination, and 92% pronation. So I see those numbers and I immediately light up. I want to restore myself to not just average, but healthy as can be. And the other one I'm going to show you is operative versus non-operative treatment of distal bicep ruptures, a systematic review and meta-analysis. So this study here represents the first systematic review and meta-analysis to compare functional and clinical outcomes following operative and non-operative treatments of distal biceps tendon ruptures. Operative treatment resulted in superior elbow and forearm strength and endurance, as well as superior DASH and MEPS. So with those in mind, I did want to restore and regain full or close to full function of my elbow and my bicep tendon because I'm an active young man. So that was also a consideration. My age, my health, my activity level, I have no underlying medical conditions, I eat very well, I don't drink alcohol, I don't smoke. These are all considerations that I took under before deciding to take the surgical route. And this is not medical information advice for anyone. However, I do think these are all good context for you to have. These numbers show that there is a little bit of risk, but there's risk with everything, and the risks are mainly around, it showed nerve. It could affect your nerve, your radial nerve in your arm, and all of the studies that I saw showed that that would go away with time. So very minimal risk in that it would heal with time. There's always risk of infection, the surgery not going as well as it could. Those were all things I considered, but it was an easy decision to make. It will heal. And post-operation, I've got my splint here. I'm supposed to be wearing this as much as possible. However, I do want a little bit of a break. So I take it out. I have pretty good function in my arm, and we're going to do a little follow-up with Doc next. So this is Dr. Minaz, a good friend of mine who was the one that referred me to the MRI and the orthopedic surgeon. I'm going to have him introduce himself, tell you a little bit about himself, and then we're going to assess my arm 15 days post-operation.
Got it. Hey guys, my name is Dr. Minhas. I do sports medicine in Toronto, and Range basically was, I think, hanging from a bar, and unfortunately sometimes it happens. It's a freak accident. He heard a pop, and then we did an assessment. When he came to the office, the first thing we noticed is that his bicep, instead of being stretched out like this, he had a reverse Popeye sign where his bicep is actually a bit higher up. So we could tell based on the history that he had a pop, he felt some pain, and the bicep was a bit up with the reverse Popeye sign, that he possibly tore it. But then we did a physical exam. We did, remember the hook test? Yes. And we couldn't find the tendon. And the last thing we did was something called a squeeze test, where your arm wouldn't even pronate after squeezing the bicep, right? Yep. So we knew it was a tear. We got an early MRI. The problem with this issue is that you need an early MRI. If you don't get it, within 2 weeks, there was so much scar tissue, it's hard to pull the tendon down and attach it.
Very important. Very important. 2-week window.
Yeah. So proximal bicep tears aren't as bad, but distal bicep tear, we have a timeline where we have to get an MRI, get you seen through a surgeon, and get it attached within 1 to 2 weeks. The earlier, the better.
Yeah. And how does it look now?
To be honest, surprising.
16 days.
Yeah, it's surprising. You're doing better than expected.
Alhamdulillah.
So alhamdulillah, I think it's good. What we can do is, the main thing is just look at the range of motion. So his range of motion is going right now. The first 2 weeks, it's immobilization, but Range doesn't want to listen. So he's actually doing a rehab, and he's doing fairly well, but he has to just maintain the range of motion in the first 2 weeks. And then the first week is immobilization. Then you try to get the range of motion, and then you go through strengthening. But this looks good. And you can we're going to put it to the side, and then I'm going to try to push down a tiny bit. Yeah, so see, you can tell he has strength. His strength is 5 out of 5 right now. So it looks pretty good. Like no complaints from my side.
So, Doc, regarding the recovery, how long am I looking at to return to weightlifting, lifting exercises at my full capacity?
You know what? Everyone's different. I think everyone's different because you're a trainer, so you had great strength before this injury. A lot of your muscles, like the brachioradialis, and the common extensor muscles in your forearm, they're going to help you with recovery as well. So in your case, every case is different. It depends on the type of surgery. It depends on who did the surgery. In this case, with a distal bicep tendon, it can vary from 6 weeks. I wouldn't say you'll be fully back to lifting like you did before, but it can take up to 3 to 6 months.
Got you.
Yeah.
And in terms of function in my arm, what are we looking at? Will I get full function of my elbow?
After surgical intervention, everything is not like it originally used to be, but I can tell you this much. If you did not do surgery for a distal bicep tendon tear, you could live through your life, but it would never had the chance to be like it used to be. Only with surgery you have that chance to get the strength back as like it used to be. And can
Perfect.
you get it? It can happen, yes.
Perfect.
Yes.
Last question I have for you.
Yes.
There's a lot of trends online about biohacking and ways
Yes.
to speed up the healing process. I'm doing just basic stuff like sauna,
Yep.
red light therapy.
Yes.
Is there any other benefits to something else out there that I could use in terms of healing the tendon, healing the elbow, the radial bone? Is there anything else that you would recommend or?
You know, there's so much out there. I think we can't get away from the basics. The rehab portion is the most important portion. Nutrition is important, but now you're asking about biohacking specifically. In biohacking, you could use even PRP. That's really not biohacking. It's actually a lot of research behind it. The problem with PRP with the distal bicep tendon is it's hard to inject that area, and could have done the PRP during or after surgery, right? In regards to other biohacking methods, there's peptides available. There's TB500 and BPC157. A lot of people think you have to inject BPC at the site of injury, but no, you can just do it subcutaneous in your belly fat, and that should help too with the recovery. So if I had to use something, I'd probably use BPC157 maybe 6 weeks post.
And that is not on the site?
I wouldn't do it on the site because it's tough to do it at that site. There's a lot of
Why?
Because of where the distal bicep attaches. It goes deep. There's the artery that's there. There's the nerve bundle that's there. So it's just a difficult injection to do there, even for doctors, let alone the patient themselves. So I would just do it subcutaneous in the belly fat.
In the belly. Okay. And you say it's worth taking or?
There's a lot of research behind it. So yes, it's hard to go against research. It is worth taking.
Awesome.
Yes.
Awesome. Thank you, doctor.
No
I appreciate it. Don't
Well,
shake
take
so
it easy
hard.
on your hand,
Okay.
yes,
All
yes.
right. Thanks so much.
All right, brother.
Follow him online, Dr. Rizwan Manas. I'll link his page in the video here. All right, so we heard from Dr. Manas about my recovery on the distal bicep surgery that I underwent recently. Now, what does my recovery look like? I'm going to take you through my protocol week by week, how it looks, and how I'm recovering through all of this. And during the first 10 days, I had stitches in my hands. I think about 4 or 5 stitches, nothing major. But I did work out 4 days after. I had to have a bandage around my arm for 4 days. On day 4, I took it off and I wanted to move. So I came to the gym where I work and I moved around a little bit. I threw the kettlebell around, did some exercises, and everything felt fine. It wasn't that I was trying to go too hard. And the reason was because I had an open laceration in my arm I was recently operated on. I didn't want sweat getting in there, just the risk of infection. I don't want to overly scare anyone, but it was just something that I said it wasn't really worth it. I did a little bit of working out and it felt good, but I just stopped myself and let myself heal. The first week, the most important thing on recovery for me and the most regenerative was sleep. I woke up feeling better each day significantly. And that's the one thing I wanted to make sure that was the most important during week 1. Just prioritize my sleep, my recovery, let the body heal, let it do its thing. And when I started to, after week 1, when I started to do a little bit of exercises, I got a very vague response from the post-op surgeon about what to do. He kind of said, just go through your stretches, but he didn't show me any exercises. Me being in my scope of practice, that works out because I know kind of what I wanted to do. and I have a system and a hierarchy that I want to go through with you here. So on day 9, before I got my stitches out, I did some joint circles and an exercise, the 2 exercises I usually use, and they are the Zottman curl, or if you do it unloaded, it's like a controlled joint articulation. So I'm just going through flexion, extension, supination, pronation of the hand. I did that the day before I got my stitches out. I had a bandage around my arm, so it was kind of catching me. It was kind of stopping me from fully extending my arm, and obviously I just had the surgery. Now we are on week 3. So after I got my stitches out, we are into week 3, 17 days post-operation today at the time of filming. And all I'm doing is I'm not trying to do any load bearing right now in terms of external load. The hierarchy I use are these guys, bands, great to use. Post-rehab, post-injury, these are when bands really come in. They're not my favorite tool by any means, but in my situation, they're very handy. So I start with range of motion exercises to make sure the arm's moving okay. And most of my range of motion is back. It just takes a little bit to warm up. That's the beauty of tendons. They take a lot more to kind of get some blood flow to them rather than a muscle. So the first step I will do is loading this with a band, because the tension is not constant, and I can lighten up on it. And I can make it harder if I wanted by making the slack a little bit shorter. Okay, and my standard is just doing this 3 sets of 10 once a day. That's fine with me. I can ramp it up to 2 times a day. The other one I want to do is the opposing side of that action will be the tricep extension. So I'll do this on the floor so you can see. I'll put my band under my back. Okay, I'm just supporting my elbows so I don't cheat and move. I'm just trying to extend, flex the tricep at the top, and I'm supinating when I'm pushing my hand up. So if I did that with a band, look a little bit like this. Again, I can adjust how much slack I have on that band. I'll do a set of 5 quickly. So those 2 exercises are what I can ramp up by using a band, and then after, slowly, I will get into overcoming isometrics. So from joint articulations to adding tension with the band, then we're going to move to overcoming isometrics. Basically, it's our ability to push or pull against something that is immovable, an immovable object. So I got the rack set up here, that's a friendly height, and if I was sitting down, this is just basically a bicep curl, but these racks are locked in and I'm not going to be able to move it. But if I ramp up the tension and I try and lift it as much as I can get some good tension onto the biceps and the bicep tendon, for example. And if I was to go, let's go this way here, I'll show you from the back angle. I can do the triceps as well by using a dowel, keeping the elbows close and trying to push up as hard as I can. I'm not going to move that, but I can get some good tension on the triceps. So these are what I will use for the next week and a half during week 3 until I can ramp up a little bit. Now, my standard is to get to a point where I can do a Zottman curl. I'll show you really quickly with 30 pounds. So this is cold, no warm up. A Zottman curl is just basically the joint articulation with the dumbbell. As you can see on the left hand, I'm okay, and I'm loading up the eccentric motion of the exercise. That is my standard for getting my right hand to. The doctor said 4 to 6 months. I'm going to keep that as fuel. We'll see how I go. I'll keep you updated. Thanks for watching. Please follow Dr. Manas on his page. I'll link it here. Give me a follow if you want anything, if you want to learn anything regarding movement, strength and conditioning, injuries, and all that good stuff. Thanks for watching. See you later.